fight for those still living. Violence against the trans community is at the highest in Ireland than in any other European country. We are laughed at by guards when we try to report hate crimes. And the political establishment refuses to acknowledge this as an issue. Mental health services are being cut across the while the government invests in things like greyhound racing. Belong to School Students Climate Survey reported that 73% of LGBTQ+ students felt unsafe at school, and 70% of them are verbally harassed because of their sexuality, gender expression, or ethnic origin. This has such a negative effect on LGBTQ+ students. Yet there is little support for these students. The church runs our schools and hospitals. We need a separation of church and state so students learn about their own identities without stigma or shame. We need publicly funded mental health services that doesn't blame an LGBTQ+ person's poor mental health on their gender or sexuality. These services could help save lives. Nearly 50% of trans people have self-harmed, and almost 76% have thought about committing suicide. It is not enough for the HSE to have campaigns about mental health. There needs to be real change. These services need to also be inclusive of LGBTQ+ travellers. The suicide rate among the travelling community is six times higher. We must stand in solidarity with our trans siblings in the travelling community. We call for the end of the stigma around the travelling community and better mental health services for trans people, in the community. One of the most pressing issues for the trans community in Ireland is the lack of adequate trans healthcare in this country. It is unacceptable that Loughlinstown misplaced over 100 names on their waiting list, many of whom have been waiting almost 3 years already, just to be placed on another 3-year waiting list. This is the same system that demands we tell our doctors details about our personal lives in order to assess whether we are truly transgender, and treat us like we have a mental illness while also contributing to our already negative mental health. Dr. O'Shea can say 1,000 times that this system is the best practice for those he sees as truly transgender, but it doesn't change the reality that Ireland doesn't provide a healthcare service that fits the needs of the trans community. People stood in solidarity with those who had to travel abroad for abortions. Now it is time for this solidarity to extend to the trans community. We must also understand that the fight for trans rights does not stop in Ireland. Today we mourn the loss of our trans siblings abroad as well, and we fight so that trans people will be liberated internationally. We stand with our siblings in Brazil, where every day is a constant struggle under the fascist Bolsonaro. Brazil has ranked first in the number of murders of trans people in the world for several years. We stand in solidarity with trans people in countries like Saudi Arabia and Nigeria, where being trans could mean the death penalty. We stand in solidarity with our siblings in the US, where there has been a reporting of 31 trans people being killed, the majority of them being trans women of colour, since October 2018. Laws are not enough to keep us safe. We need a different system, a system that doesn't put the need for the 1%'s need for profit over people's lives and well-being. We need a system that allows trans people to exist without stigma, without shame. We need to fight for a system where trans people are not forced into boxes that don't fit them, where trans people don't have to choose between staying in the closet or face discrimination for who they are. We need to fight for trans liberation globally. Thank you.